Hi class, this is Dr. Heather Austin Robillard, and this lecture video is going to be over the last full threshold diagnosis in the DSM, which is binge eating disorder. Unlike anorexia nervosa and bulimia nervosa, binge eating reflects a shift away from the individual reporting attempts to fully control of their eating behaviors and their weight. It shifts to an individual who reports feeling very out of control over their eating behaviors. Binge eating disorder, or BED, is further separated from bulimia nervosa as the individual does not engage in purging or restricting behaviors. In this module, you will learn about the signs and symptoms of binge eating disorder, the DSM criteria, emotional symptoms associated with BED, and the health consequence risk factors of this diagnosis. Binge eating disorder was originally classified in the DSM-4 as of the subtype eating disorders not otherwise specified. But in the most recent edition of the DSM, DSM-5, which was published back in 2013 by APA moved binge eating disorder to one of the full threshold eating disorders along with bulimia nervosa and anorexia nervosa. This became the third recognized eating disorder as a full threshold diagnosis. An individual with binge eating disorder has recurrent episodes of eating significantly more food in a short period of time than most people would eat under a normal circumstance. Individuals with binge eating disorder report having significant feelings of being out of control in regards to their eating behaviors, and they report a lot more distress related to this out of control feeling. Individuals with BED do not engage in purging or restrictive behaviors, which is commonly found in bulimia nervosa. But not all of the individuals with BED are overweight or obese. Finally, binge eating disorder can occur in patients with anorexia or bulimia nervosa, but BED is not accompanied by a regular use of compensatory behaviors or behaviors that intend to regulate one's weight. Many researchers and clinicians believe that binge eating disorder is actually the most common eating disorder in the United States. Binge eating disorder can affect 3 times the number of people diagnosed with anorexia and bulimia combined. Binge eating disorder is more common than breast cancer, HIV, and schizophrenia. The research shows that 0.7 to 4% of the general population may struggle with binge eating disorder. Research shows that binge eating is associated with being overweight and obese. You can be obese and not have binge eating disorder, however. With bariatric patients, anywhere between 14 to 56% of those seeking bariatric surgery have been diagnosed with binge eating disorder. 3 out of 10 individuals looking for weight loss treatments also show signs of binge eating disorder. Unlike other eating disorders we've discussed thus far, binge eating disorder has much less disparity across racial and ethnic groups. It is just as prevalent for whites as it is for Hispanics or African Americans. The World Health Organization, or WHO, found generally comparable prevalence rates across all countries as well. One caveat is that BED does look differently clinically across different racial or ethnic groups. For example, African American patients with binge eating disorder do have a higher BMI than those of white patients, but they did report similar binge eating episodes. White individuals with BED have been reported to be more likely to seek treatment, and these patients tend to engage in binge eating behaviors at a much earlier age than those of other racial groups. When it comes to the difference between men and women, men actually do struggle with binge eating disorder much more than other eating disorders. Men tend to have a co-occurring disorder with substance use, and women tend to have a higher drive for thinness, body image dissatisfaction, and eating behaviors motivated by self-soothing when they struggle with binge eating disorder. There is a ratio of 3 to 1 for women to men with binge eating disorder. some research shows that up to 40% of those struggling with binge eating disorder are men. Binge eating disorder is located as a full threshold in the DSM-5. Let's look at some of the diagnostic criteria. So in order to be diagnosed with binge eating disorder, you need to follow these different criteria. The first one is there needs to be recurrent episodes of binge eating. An episode of binge eating is characterized by by both of the following: eating in a discrete period of time, so within a 2-hour period, any amount of food that is definitely larger than what most people would eat in a similar period of time. There also must be a sense of lack of control over eating during these episodes. Like they feel that they cannot stop themselves or cannot control what and how much they put into their mouth. They also need to have binge eating episodes associated with 3 or more of the following: either eating much more rapidly than normal, eating until completely uncomfortably full, eating large amounts of food when they're not actually physically hungry, eating alone because they may feel embarrassed by how much they are eating, feeling disgusted with themselves or depressed or very guilty afterwards. C, they need to have a marked distress regarding these binge eating episodes. The binge eating has to occur on average at least once a week for 3 months. The binge eating also cannot be associated with a recurrent use of inappropriate compensatory behaviors, e.g. purging, which would be bulimia nervosa, and does not exclusively occur during the course of anorexia nervosa, bulimia nervosa, or avoidant and restrictive food intake. So basically, they cannot already be diagnosed with another eating disorder in order to be diagnosed with binge eating disorder. When looking at the diagnostic criteria, we can also identify some of the subtypes. There's a dietary restraint. So this has no mood disturbance associated with their symptoms, but they do have a dietary restraint that was present. The second subtype is mood disturbance. So there are higher levels of eating concern, weight and shape related concerns, or body dissatisfaction. They also have higher rates of MDD and dysthymia, anxiety, trauma, and abuse history, or lower levels of self-esteem. The last category or subtype is substance use disorder. They have a history of a diagnosis of alcohol or drug abuse or dependence, and more binge eating episodes occur during those times or at greater levels of impulsivity. This picture describes a cycle that is commonly experienced by those with binge eating disorder. It discusses the why, when, what, how, and how much, and where the engagement of the binge eating episodes occur. This cycle is perpetuating that unless an individual attempts something new, it is very difficult to break out of the cycle. Breaking this cycle would be the focus of a treatment provider. An individual may engage in a binge due to unmet needs or the desire to escape from difficult life situations. When they engage in the binge is likely due to the feeling of being triggered by a physical, emotional, or environmental factor. What triggers can you think of? We could consider the individual who has had a fight with their boss and felt very stressed about their day at work as a trigger. This could trigger the need to escape and thus motivate a binge. When we think about what binge behaviors typically use forbidden or off-limit foods or comfort foods. Think about snack foods, desserts, foods high in fats or sugars, and processed foods. Looking at the how of the cycle, this is typically engaged in as quickly as possible to limit being caught. It is done secretively in a location that feels secure to the individual and often done mindlessly. Think about eating food in front of the TV. We focus on what is on the TV and not how much we are eating. The how much part of this cycle is, remember, in order for the eating disorder to be considered a binge, it has to be more than what is common for a typical eating period, and is often to the point of discomfort and pain. The how much then would be until food is gone and one feels sick. Finally, the where of this model is, where does this behavior impact the individual and This is typically that the individual is going to feel tired, angry, ashamed of their behavior, which restarts the cycle, trying to escape from those discomforting feelings. Some behavioral symptoms of binge eating disorder include the inability to stop eating or control what you're eating, rapidly eating large amounts of food, hiding or stockpiling food to eat later in secret, eating normally around others but then gorging when you're alone, eating continuously throughout the day with no planned meal times. Symptoms of binge eating disorder include feeling stress or tension that is only relieved by eating, an embarrassment over how much you're eating, feeling numb while you're binging, like you're not really there or you're in autopilot, never feeling satisfied no matter how much you eat, feeling guilty, disgusted, or depressed about your overeating, and a desperation to control weight and eating habits. Following a binge, individuals report shame, self-disgust, and oftentimes leads to individuals with binge eating disorder also reporting depression as being comorbid to this BED diagnosis. 60% of individuals diagnosed with binge eating disorder also have some form of comorbidity with other psychiatric diagnoses. Typically, it's a mood disorder or a substance use disorder. Eating disorder marks a shift in our discussion about eating disorders and the way eating disorders are associated with lower or healthy weights to those related to overweight and obesity. Individuals who suffer with living with binge eating disorder will likely over time become obese or overweight. The health risks associated with binge eating disorder are thus related more to the weight gain and include type 2 diabetes, gallbladder disease, high cholesterol, high blood pressure, heart disease, certain types of cancer, osteoarthritis, joint and muscle pain, gastrointestinal issues, and sleep apnea. Individuals with type 2 diabetes oftentimes have an eating disorder, and most often this eating disorder is binge eating disorder, followed by night eating syndrome, which we'll learn about next. Individuals are also likely to have a nutritional deficiency because of the types of food they typically binge on. While researchers do not know the exact cause of binge eating disorder, according to a study published by the Obesity Trusted Source, dopamine levels of the brain could be a factor. Dopamine can affect a person's food intake by interfering with the person's ability to regulate food cravings, create cravings or desire for certain foods, increase how someone enjoys eating certain foods. While weight is not actually a risk factor for binge eating disorder in itself, people with binge eating disorder can be obese, overweight, or a healthy weight. Factors that increase risk for developing binge eating disorder include family history. You are much more likely to develop an eating disorder if your parents or siblings have or have had an eating disorder. This may indicate that inherited genes increase the risk of developing an eating disorder like binge eating. Psychological issues. Many people who have binge eating disorder feel negatively about themselves and their skills and their accomplishments. Triggers for binge eating disorder include stress, poor body image, and the availability of their preferred binge eating foods. A third risk factor is dieting. Many people with binge eating disorder have a history of dieting. Dieting or restricting calories during the day may trigger the urge to binge, especially if you have symptoms of depression. This is the end of this lecture, and so far you have learned that binge eating disorder, which moved to a full threshold eating disorder diagnosis in the DSM-5. Binge eating disorder is marked by an out-of-control eating and not engaging in compensatory behaviors or control of one's weight. Oftentimes, individuals with binge eating disorder will be overweight or obese, but this is not always the case. Other disorders, binge eating disorder individuals do have a higher comorbid diagnoses, especially with mood disturbances such as depression or anxiety. We also learned about the consequences of binge eating disorder, which are commonly related to their overweight or obesity. You'll learn more about obesity and food addiction in some future lecture videos. Thank you.